Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 4, Clinical Governance, Leadership and Risk Management in Healthcare, for the Chapter 41, Clinical Audit Part 1, we will be studying about clinical audit, medical audit, which can be seen synonymous to us or not, or types of clinical audit process, and stages actually preparing the audit and selection of a topic. So, the in the introduction part, we may come to know that the effectiveness of a healthcare system is fundamentally built with structure, process, and outcome framework. There is always this discussion that when we take up this model, the ultimate success of care is validated by monitoring the clinical and managerial outcomes. So, outcome is more by monitoring, and the monitoring comes or clinical outcomes come more benefited if we are doing clinical audits to the benchmark of performance. And what are the benchmarks to the performance? It is more towards achieved actually or against the established best practices. So clinical audit is a quality improvement process, and this process is aiming at improving patient care and outcomes through a systematic review of care against explicit criteria. So there is an explicit criteria where you need to take ahead this. The clinical audit involves evaluating the structure, process and outcome of care, which is highlighted over here. And it is followed by implementation of change at individual, team level and service level. So you may come across that when you are doing the evaluation of structure, process and outcome, it should also follow the implementation of the change that we are trying to strive for. The ongoing monitoring is used to confirm and sustain the improvement in the healthcare system, which is also the need to be understood in healthcare quality. Historically, the concept of auditing care dates back to King Hambourini by Babylon, while the modern clinical audit evolved through the work of Florence Nightingale and Dr. Ernest Codman. And further, it was formalized by the UK National Health Services. In the year 1989, white paper Working for Patient was introduced on medical audit, which gradually evolved to clinical audit. So you can understand how the process of evolution of audit reached to the clinical audit in healthcare. So clinical audit focuses on identifying the gaps between the established standards and the actual practice. What is there which is there in the standards across what is there into the actual practice is all what we can say is a clinical audit. Clinical audit ascertains the fact rather than finding faults. Today, clinical audit is widely used as a first step in quality improvement initiatives, and it forms a core component of accreditation process. When we discuss about JCI, NABH, NQAS, all needs actually a clinical audits to taken care of. Is clinical audit and medical audit synonymous? Initially, the audit of clinical practices was known as medical audit, and we see that in the previous section that we saw the evolution actually of audit also states that how it is being seen of evolving from medical to clinical. Clinical audit focuses on care provided by a doctor to a patient and was conducted by the peer doctors. With the evolution of healthcare, patient care become to be more delivered by multidisciplinary team, which is including nurses, dietitian, rehabilitation therapists and other professions. So this shift highlighted the need to evaluate overall patient care rather than only doctor provided services. So as a result, what we are trying to understand now today as a clinical audit was evolved from the medical audit, and clinical audit assess the quality of care delivered by the entire healthcare team. So you can say clinical audit is something which is a quality of care delivered by entire healthcare team, and they are evaluating it, assessing it. where versus medical audit was only focused on care provided by a doctor to a patient and was conducted by the peer doctors actually in assessment of this process. What is the type of clinical audits? There are four types of clinical audit where traditionally recognized: standard based audit, adverse oblique critical incident audit, which is significant evident audit, peer review audit, which is done especially for morbidity and mortality audits, and patient surveys. Earlier, all four were considered clinical audits. As per the current guidelines, only standard based audit is considered as a clinical audit. So standard based audit places as a first and a major role, and the standard based audit is discussed in the further in this chapter also. Medical audit is considered as a subset of clinical audit, rather not interchangeably being used or synonymously used to clinical audit. What is clinical audit process? So clinical audit process aims at service improvement. Service improvement is the ultimate objective of taking clinical audit. Clinical audit is achieved by comparing current practices against the set norms. What are the current practices which is going into the hospital against what are the set norms to achieve that? It also adds for the actions that are implemented to rectify deficiencies or improves service provision, which is very important and a base actually to see the purpose of clinical audit. What is the process of clinical audit? Identify the problem or issue which is lying over there. Set a criteria and standard. Third is to observe, practice and collect the data for this. Then at the fourth level, make the improvements into those. And lastly and very importantly, sustain the improvement which has been taken by the entire team or by the hospital. So this is a guideline that we can see that the clinical audit process comes with, which is very important, that this takes ahead actually as a cyclical process where sometimes you have to work on one or even take this cycle as twice or thrice also. Stage 1, preparing for audit and selection of the topic. Suppose you are taking in your clinical setups a audit, actually you need to work on these steps and you can identify where you can improve or where you are fail. Failing to plan is planning to fail. So prior planning is a key step in clinical audit. So it is very important that whenever you are selecting a topic or selecting an appropriate topic or defining the aim or purpose and objectives of the audit is very important. So selection of topic is starting point of the clinical audit. It is like a corollary of quality improvement. Choosing an appropriate topic is imperative for successful clinical audit. Clinical audit topic should be chosen based on audit priorities. Whatever audit is being to be taken or being seen, according to that the priorities are decided. The best approach is to involve all concerned stakeholders, where you can get a benefit actually to prioritize the topic actually and to make that what is the reason that you are taking this audit. Like clinicians can be the stakeholders, nurses and administrators. They can collectively discuss and decide the priorities actually. And NICE guidelines actually suggest using 8 prioritization questions, which include cost, volume, quality, problem, availability of good evidence and potential for collaboration. So NICE guidelines actually, as we have seen into the previous topic actually, which we can say of all the cyclical process that we have to come across, is giving us a benefit actually to understand the prioritization questions. This is an audit process which is being displayed, which has the types of audit, aims and objectives. When you come across the discussion of audit, who can be audited is very important. Is it the structure, is it the process or the outcome? Can be an combination of all these three. Structure audit, we take infrastructure, we assess the availability of staff, functioning of the equipments, or in process audit we take the history taking, clinical examination, investigation, treatment and adherence to protocol are also assessed. What about the outcome audit? What are the changes in the health status of the patient? What are the outcomes after the treatment? Or what are the interventions? So, audit becomes a part which can be taken at first level or a structure audit or a process audit or even outcome audit or even can be a combination of all three. What is the defining purpose, aim and objectives? When you come across as a planning to be seen as very important when you are taking an audit, define the aim, focus on the achievement, explain the whys actually, because if you are explaining the why, it is very important to resonate into the team that it is linked actually to the rationale of the project. Phrased positively like to improve, to enhance, to ensure or to take ahead or to change. In that way you can make this as a purposeful audit. Examples of aims: improve hypertension care or increase control diabetes, ensuring hand hygiene adherence, or questions: are we meeting standards? So you can take ahead actually that it is very important to see that that very important way of dealing with comprehensive patient care or topics which are more towards directing the healthcare institutions development can also be taken. After that, you need to set up objectives for this. Break down the aim actually which is being seen into a fragments, broad steps and strategies planned according to meeting the aim actually. Clarify the actions which are needed for this aim and clearly document the statements which are making it more beneficial. Explain the aim to increase the glycemic control or ensure proper medication, ensure patient education can be seen as an example actually to set up actually for this objectives. So, in summary to this topic actually of clinical audit, we can say that clinical audit is a quality improvement process that systematically reviews healthcare practice and against an explicit standard to improve patient care and outcomes by evaluating the structure, process and outcome of care. The concept evolved from medical audit that was doctor centered and peer reviewed to a clinical audit which is reflecting more on the shift towards a multidisciplinary team based healthcare delivery, which is very important to see here that clinical audit focuses on identifying the gaps between established norms and actual practice within the objective of fact finding rather than fault finding, followed by implementation and monitoring of change, which is very important for the sustainability of this project. Clinical audit follows a continuous cycle. The cycle starts with identifying a problem, setting standards, measuring the practice, implementing the change, and sustaining improvement to enhance the quality of care. We can see this into the five step cycles. Stage 1 of the clinical audit process emphasizes prior planning. Prior planning is very important, which is including the selection of an appropriate audit topic and a clear definition of the aims and objectives, which forms the foundation of effective quality improvement. So, it is very important to see that when you take up the clinical audit, the stage 1 should follow all these things. With this, we come an end to this chapter and we will take ahead actually this discussion ahead into the concluding sections of the other topic. Thank you very much.